I'm Dr. Nancy O'Hara, and I'm a pediatrician, an integrative pediatrician in the States. I am here to talk to people at Mind because I think it's very important that we look at our whole bodies and that we look at our health in a very integrative way, combining the gut, the immune system, the metabolism to help each of us reach our fullest and healthiest potential. I think it begins and ends in the gut. I think the way we need to look at things and the way we need to get better is to first look at how we're fueling our bodies. And we need to fuel our bodies with good food. As a friend of mine says, there's no such thing as junk food, it's either junk or it's food. So if it's fresh and unprocessed and full of nutrients, then that is the first step in us getting better. And then I think we have to look at our environments, both internally and externally, to see what we may need to get that we're not getting and what we may need to get rid of that we have too much of. So that may be a nutrient like zinc, especially magnesium. It may be a food like more fruits and vegetables. Or we may need to get rid of excess germs, parasites, yeast, Clostridia in our body, or toxins that we've been exposed to. In our clinic, we see children with all types of chronic illnesses. We have a large percentage of children with autism who have behaviors that are labeled autism that are really about pain, discomfort, inflammation, lack of normal metabolism that may be going on in their bodies. And we find that when we treat that, then the behaviors get better. We also have children with inflammatory bowel disease that rather than being treated with medications are being treated with diet, antimicrobial therapy, anti-inflammatory herbs, essential fatty acids that are helping them to get better. There are a lot of anti-inflammatory foods. I think most importantly, the more brightly colored, the more anti-inflammatory. So when you think about your brightly colored fruits and vegetables, those are great. Also oils. We often forget about good oils. Olive oil, coconut oil, and essential fatty acids, omega-3s, are very good anti-inflammatories. Thirdly would be fermented foods. Those are foods that are high in probiotics, good flora that we need in our bodies. Fermented foods like kefirs, kombuchas, fermented cabbage. And then finally, I think a balanced diet that has good oils, good proteins, good fresh fruits and vegetables is an anti-inflammatory diet. When we look at children with autism, we see a variety of outcomes. I'd say first of all the children are healthier. They're more available for their therapy. They're more available to learn. They're not constipated. They're not in pain. And then there are some children that recover. Usually somewhere between 20 and 30% of kids will fully recover. Somebody once used the analogy of getting hit by a bus. You don't get cured of being hit by the bus, but you can recover from it. So with good diets, nutrients, removing the bad stuff, some of these kids can recover, and many of them, if not all of them, can be better. I think what's important when we look at all of these children is how we treat them as parents, as practitioners, and number one, decreasing the future stresses as much as possible. I mean, we live in a very stressful world. We can't live in a bubble. There are always going to be stressors. But if we can teach our children to live healthfully, even after they're out of our cocoon, that this will really be helpful. I think the other thing is to promote and push their self-esteem. Because if children feel good about themselves, then they will succeed. And I think finding that thing that they are good at and helping them to succeed at that and to show them their abilities rather than any disabilities or differences really helps them to be the best that they can be. When I think about autism, I often think about autisms because this is such a spectrum. And when I see a child, I don't think about the label of autism. I look at what is this child going through? What are the things that are happening in his or her gut, in their brain, in their metabolism that I can identify, and mainly by history and physical exam. I don't have to do a lot of lab tests. And then using that, what is it that I can do to treat it and to help that child be better? If there was one piece of advice I could give to moms, it would be to love your child as they are. Because I think stress is one of the biggest culprits that takes our lives and our children away from us, trying to change them. And I often use the analogy of a gift. You know, these children are gifts just the way they are. They may have 9 or 10 layers of wrapping paper that we need to unwrap and figure out the true gift inside. But at every stage, don't forget that each of these children are gifts. And then I think there are some very exciting interventions on the horizon, and one that I would like to mention is something called helminth therapy. And the idea is of the missing microbiome, or the hygiene theory, and that is that we have totally changed our insides by the way that we live. Living indoors without vitamin D exposure, wearing shoes, using toilets, using antibiotics, C-sections, formula, all of these things have changed our microbiome. And our kids, epigenetically, genetically, are more susceptible to those changes. And so they haven't been able to adapt. And what we can now give is something evolutionarily all of us have had, and this is a helminth, which happens to be a grain beetle worm egg that incites an appropriate immune response and starts to change that microbiome, that germ life inside of us, which is actually 90% of us. We are only 10% us, 90% germs. But anyway, the idea is that we can reset the immune system to start acting appropriately. And we have seen marked improvements in many autoimmune diseases, inflammatory bowel disease, allergies, asthma, atopy, but also in autism and ADHD with improvements in anxiety, attention, OCD, and tics. And I think it's a therapy that's on the horizon for many of us suffering with chronic disease. I think when we look at children on the autism spectrum, we look at all of them as they are. And that's who they are as a person, their history, their physical exam, and very rarely do tests, especially genetic tests, because it's really about what's going to help that child improve. And if we can get that child and that family to eat a good diet and decrease their stress and get their nutrients through diet, then I don't care what their genetics show. I really just want to see how that child improves. And if we could do that for all of our children, healthier diets and providing the things that they need and getting rid of the things that they don't need, then we really will see a big decrease in all of these chronic illnesses. Not just autism, but diabetes, inflammatory bowel disease, asthma, allergies. And I think the genetics often just confuse the picture. It may depress you, it may be giving you information that you don't need, or that you don't know what to do with. The proof is in the child, the N of 1. And the only time I talk about getting it is when she wants to have children. And if she's not doing all the things to keep her body healthy, maybe we may need to add a little bit more methyl tetrahydrofolate or zinc or something at that time to help her pregnancy be as healthy as possible. But other than that, treat the child, not the test.